Good afternoon. Thank you for watching our live briefing for Monday, June 1st. We have a lot to share with you today. After my update, Glenn Kemp has some information for you, and then Lynn McClintock has our pastoral care segment. To start out with, I want to just take a quick look at the COVID-19 situation nationally. We've had about 1,760,000 cases, with just under 104,000 deaths. Here in Virginia, we've tested 322,568 individuals. It's an increase from yesterday of about 9,200. And we've been doing about 10,000 tests a day, which is an increase from where we'd been for a long time, and that's good news. Cases currently sitting right at 45,400, just a couple less than that. The positivity rate, which we've been watching to let us know how prevalent the infection is out in the broader community, for the Commonwealth of Virginia, the positivity rate has dropped to 11.8%. That's a decrease of 0.6% from yesterday. It's a good decrease. It's been going down about 0.5% each day, and that's good news. For Henrico, the 7-day rolling average is down to 13.0%. That's also a decrease of about 0.5 percentage point. And then, if you've been watching along, you'll recall Richmond had been very troubling at about 25%. Well, they changed the data again on Saturday, and they shared that, in fact, the way they were determining what the positivity rate for different zip codes were based on the origin of, well, it was based on the data that the patient provided. And so there was a very large number of cases that had no zip code. And so what they did is they applied the zip code for the laboratory. And it seems Richmond got a very high, Richmond was very misrepresented. And so when they corrected it on Saturday, we saw the rate go from 25% to 13.6 today. It's at 13.6, down from about 14 yesterday. So much more sort of normal with Henrico and Chesterfield. And so that's very good news for this local area, because we had been looking at that and really concerned about what was going on in Richmond. Well, we find out really it was just the way the data was being represented. So that's good news. Richmond's at 13.6 and down 0.5 from yesterday. Hospitalizations to date, it's been almost 4,700. Deaths, just under 1,400. And in terms of long-term care facilities, we've had 214 outbreaks in the Commonwealth of Virginia that amount for 4,920 cases and 785 deaths. Now, you will recall, if you've been watching each of these live briefings, you'll recall that late last week, I shared with you that we were testing all the residents in the Parsons Health Center for COVID-19. The testing is required for us as we begin planning for the day when the Virginia Department of Health and the Centers for Medicare and Medicaid Services will allow visitation with residents of Parsons Healthcare Center. I'm very pleased to share with you today that the test results are all back, and all of the residents of Parsons Healthcare Center are negative for COVID-19. It's really good news. It's the baseline we expected, but you never know. So it was very good news to know we have no cases amongst our residents in Parsons. Testing everyone was part of our preparations for a point in time at which our regulatory agencies that oversee the Parsons Health Center will allow visitation. As you might know, in case you don't, Parsons Health Center is regulated by a state agency, the Virginia Department of Health, and the federal government through the Centers of Medicare and Medicaid Services. Both VDH and CMS have regulated that all long-term care facilities be closed to all but non-essential staff And so really, we've not allowed any visitation. We've not had any staff coming and going, except for those that must work in Parsons Health Center. The only exception is for end-of-life compassionate care situations, which we certainly have had a few, but by and large, Parsons remains closed. This testing is the first step in our preparations, and what we had to have was a negative baseline test for all Parsons Health Center residents. So that was completed yesterday, and we're through that first step. Our second step, which is part of our plan, is to create a safe, structured place and process where when the state and federal government allow it, we can begin to offer some visitation. We expect that that process will be completed this week, and so by the end of this week, we will be ready for the day when the regulatory bodies say we can move forward. We don't know when that will be, but we will be prepared when they lift the restriction. We're hopeful that it'll be soon, but we really don't have any control over that. Other topics that I want to talk to you today about, as you know, hopefully you know, we initiated step 2 of the Westminster Canterbury Richmond Next Steps today. Today, the fitness center, the aquatics, the pool, and the rehab programs restarted. It was really nice to see some of you taking advantage of those opportunities today, and to see the staff back, working with residents again in those areas. And the residents that I spoke to were real excited to be back exercising or doing therapy. We are also very excited to begin our first real in-person live entertainment activity tomorrow with live music on the Ellipse called Tunes on Tuesday. This will take place on the Ellipse at 11 a.m. Hope you'll come out. It should be a nice day for it. I do want to stress that you need to practice behaviors of social distancing. Please take the time to practice staying away from each other. And remember, you must wear your mask when you're either in the building or when you're near others outdoors. These behaviors are incredibly important for us to stay well, especially as we move into the coming weeks. Because later this week, we're going to be sharing with you the details of Step 3, which starts next Monday, June 8th. As you probably know, beginning next week, independent living residents who choose to will be permitted to leave campus to take care of essential personal business and to take themselves to and from medical appointments. We, management, will not be determining or defining what is essential. That is for the residents to determine. We need you to determine that it is essential for you to do it, realizing you're safer here and that it is not safe to be out in the community and get exposed to the virus. But if you need to do it and if you choose to leave campus, you need to wear a mask and you need to comply with all the social behaviors of distancing and washing your hands. The point I want to leave you with today, and I will repeat myself repeatedly this week, is starting next week, everyone on campus needs to protect themselves by wearing a mask and keeping your distance from each other. You have all stayed well because staff, some of whom have gotten COVID-19, have worn masks, they've regularly washed their hands, and they've stayed home if they don't feel well. Most importantly, they've kept their distance from you. Starting next week, you need to stay well by wearing your masks, washing your hands, keeping your distance from each other and from us, and self-quarantining yourself if you're unwell until you can be checked out by the clinic or the physician. So it's a big switch next week, right? All of a sudden, residents are going to be out in the community and are going to be potentially exposed like staff have been. So starting next week, you're going to have to protect yourselves because we, management, can't really protect you beyond keeping staff away from you. So enough about that. We'll talk more throughout the rest of the week, and we'll get into the details of what happens, how you go about coming back to campus and that sort of stuff later in the week. I'm going to stop there. I'm going to turn it over to Glenn Kemp. He's going to talk to you about resident vehicles.
Thank you, John. Ladies and gentlemen, as you just heard John say, starting on June 8th, independent living residents will be permitted to leave campus for essential business tasks and to attend medical appointments. We know that some of you have some vehicle issues, some vehicle maintenance that needs to be addressed. So I have some instructions for you here so that we can get your vehicles serviced. So please listen very closely to the following instructions. If you have a dead battery, we would like for you to contact Ethan Wilburn, the transportation supervisor, at extension 6263 to coordinate getting your battery jumped. If you need to get gas, you will have an opportunity to do so on June 8th when residents are permitted to travel for essential tasks. I would recommend wearing gloves. I would recommend taking some sanitation with you so you can wipe your hands down afterwards, even though you'll be wearing gloves. If you have other service needs, like body work or mechanical issues, or even to get an inspection, if your service tech can come here to campus and pick up your car, we can make arrangements starting this week to make this happen. I would like for you to reach out to me to make those arrangements. My extension is 6079. If your service tech cannot come to campus to pick up your car, you can start next week on June 8th getting your car serviced, if you consider it an essential task. I have one more quick message to you about stimulus checks, and this is going to everyone. Some stimulus checks are coming as prepaid debit cards, not just through direct deposit or a check. You should be on the lookout for an envelope which will arrive to you, which is marked "Enclosed is your economic impact payment card," and will have the Department of Treasury's emblem on it. We need you to be aware of this so that you can look for it in the mail and not throw it in the trash. There's no defined reason as to which method you will receive, whether it's a check, debit card, or whether you'll get a direct deposit. So again, please be careful not to throw away any mail from the Department of the Treasury. All right, that's it for me. Next up, we have a word from Lynn McClintock.
Good afternoon, everyone. In these video updates we've been providing over the past couple of months, Pastoral Care has focused our comments and scripture and prayers based on what we imagine residents and staff are experiencing in these times of COVID. We've addressed fear, frustration, anger, confusion, isolation, disruption, and a number of other things that we imagine as we hear from you, are struggles that you are dealing with. And so today, I know that many of you, I've heard from many of you already last week and today, are upset and rattled over the killing of George Floyd in Minneapolis, the protests and racial tensions in our city, and indeed even around the world that have followed. In these brief moments of today's briefing, there is not more to do at this point than to acknowledge that whether it is our residents or our staff who are struggling, we know that it's a struggle. I'm just going to say a word on the subject now, and please know that Pastoral Care will be working in the coming days and weeks to provide some avenues for discussion and connection on the issue of racism. Because of physical distancing, we can't do what we would normally do, which would be to fill the Cochrane Commons or even the theater with a discussion on racial relations and then support how individuals like us can make a difference in our community. Because of physical distancing, we can't even gather our staff as we would like for in-person discussion and support. So for the question that many of you have already asked, what can we do to make a positive difference? We will be listening and working on ways to help with that. But here's what I will say today, and I'm not starting with what happened on the streets of Richmond or even Minneapolis. Last week, I watched a video of a friend's 16-year-old daughter. It was her confirmation speech that she made for the congregation of Temple Bethel here in Richmond. Confirmation in the Jewish tradition is when a person in the years following his or her bat mitzvah or bar mitzvah completes a comprehensive series of classes on Jewish history, culture, and religion. It's a lot of work. And in the video I was watching, this beautiful young woman was sharing a speech that she had written as she completed her course of study. She started by sharing her experience of growing up Jewish in Richmond. She recounted a few incidents where people said very hurtful, discriminatory comments to her at school and even out in the community because she was Jewish. In the video I was watching, she openly shared the horrible comments that were directed at her. They made her and me angry, hurt, rightful emotions in the face of such comments. She had been in a local play on the life of Anne Frank, the young girl who hid from the Nazis in the attic of some folks' home in Amsterdam during World War II, and who ended up losing her life in a concentration camp. In the play, this young woman played Margot Frank, the sister of Anne Frank. At one point in the discussion, when the teachers and the other students in the play were talking and having a discussion about the play, someone thought to ask her, "What is it like for you, being Jewish, to be an actor in this play?" That one question turned everything around for this young woman. She, of course, shared what it was like for her. She was able to talk about that. But the answer she gave was not as important as the question, "What is it like for you?" No one had ever asked her before, "What is it like for you?" Because someone asked, she saw that someone cared, and that she was not just Jewish, but human. So when I see countless of African Americans who experience violence to the point of death, George Floyd, Breonna Taylor, Ahmaud Arbery, Sandra Bland, Eric Gardner, Trayvon Martin, and on, I realize that as I watch these lives being taken for something that I do not experience and probably will never experience in the United States simply because I am white. My skin color does not help me understand the anger and rage of people of color. But my heart demands that I try. My faith demands that I try. What we see in the streets or even in the courts may be viewed as an answer for some. But until I ask people who are different than me, how is it for you? I will never begin to understand. Now, honestly, I don't have a nice and neat 5-point plan to help residents and staff deal with this very difficult time in our history, whether it be racial injustice that we are seeing or a global pandemic that we are experiencing. I don't have a plan for that. but I can tell you that we will try. And I know there are many listening right now who will try. Let's stick together and figure this out. How is it for you? Why would we dare ask that? Because God's Spirit makes us bold, and God's Spirit teaches us love. And we begin with love. I close with a statement that was made yesterday by the presiding bishop of the Episcopal Church, the Most Reverend Michael J. Curry, who, for those of you who may not know, is African American himself. And he said, "Now is a time to commit to cherishing and respecting all lives and to honoring the dignity and infinite worth of every child of God. Now is the time for all of us to show in our words, our actions, and our lives what love really looks like." Our scripture verse today is Genesis 33:10. "For I have seen your face," which is like seeing the face of God. And for our prayer today, we will pray in silence. And will you please lift up your prayer to God? And let the people say, Amen. Thank you for joining us today, and we ask that you join us tomorrow at 3 p.m. for the next video update.